The case of Benjamin Geen stands as a stark reminder of the sinister capabilities that can lurk beneath the veneer of trustworthiness. Benjamin Geen, a former nurse in the United Kingdom, is a name forever etched in infamy due to his shocking acts of deception and harm inflicted upon vulnerable patients. Benjamin Geen was born on November 11, 1978, in Aylesbury, Buckinghamshire, England. His early life appeared unremarkable, marked by a seemingly ordinary upbringing. He attended local schools and, like many young adults, aspired to make a positive impact on society. Nursing, a profession associated with compassion and care, seemed like the ideal choice. Geen's journey into the healthcare industry began when he enrolled in a nursing program, eventually earning his qualifications as a staff nurse. His career took him to Horton General Hospital in Banbury, Oxfordshire, where he would soon gain notoriety for all the wrong reasons. The dark secrets of Benjamin Geen would unravel at Horton General Hospital, where he worked as a staff nurse on the medical and surgical wards. Initially, Geen was regarded as a dedicated and competent healthcare professional. Patients and colleagues alike trusted him with their well-being. However, behind the facade of professionalism lay a deeply disturbed individual. Geen's first indication of malfeasance emerged in December 2003, when patients under his care began experiencing sudden and unexplained respiratory distress. These troubling incidents, while initially isolated, soon escalated into a pattern of unusual medical emergencies. The hallmark of Benjamin Geen's malevolence was his manipulation of medical equipment and drugs, leading to life-threatening situations for his patients. Innocent patients, who had come to the hospital seeking treatment and comfort, became unwitting victims of his sinister desires. In a particularly disturbing series of events, Geen would tamper with oxygen supplies and deliberately administer potentially lethal doses of medications. This malicious behavior led to numerous emergencies, with patients experiencing severe respiratory distress, cardiac arrests, and, in some cases, even death. The unsettling pattern of medical emergencies raised alarm bells among Geen's colleagues and hospital staff. Medical professionals could not fathom the inexplicable increase in patient distress under his watch. Their concerns led to an internal investigation within Horton General Hospital, which subsequently escalated to a criminal inquiry. As investigators delved deeper into the case, they uncovered a troubling trail of evidence against Benjamin Geen. Surveillance footage, medical records, and testimonies from colleagues and patients began to paint a damning picture of his actions. The puzzle pieces were coming together, revealing a healthcare provider who had betrayed the very essence of his profession. In September 2004, Benjamin Geen was arrested and charged with a litany of offenses, including 2 counts of murder, 15 counts of causing grievous bodily harm, and 19 counts of intent to cause grievous bodily harm. His trial, which began in 2005, would become one of the most closely watched and sensational cases in the United Kingdom's legal history. Prosecutors argued that Geen had intentionally harmed his patients, injecting them with lethal doses of drugs or tampering with their medical equipment. The motive behind his actions remained a chilling enigma, leaving many to question how a healthcare provider could commit such heinous acts. The trial provided a platform for the testimonies of both the victims and the medical professionals who had witnessed the horrors unfold. It was a grueling and emotional ordeal for all involved as they relived the trauma of their encounters with Geen. One of the most damning pieces of evidence presented was the deliberate tampering of syringe drivers used to administer medication. These devices, crucial for patient care, had been interfered with in a manner that could only be described as intentional. Geen's actions went beyond negligence. They were calculated and sinister. In February 2006, Benjamin Geen was found guilty of the charges against him. He was sentenced to life imprisonment, with a minimum term of 30 years. The severity of the sentence reflected the gravity of his crimes and the immense harm he had inflicted upon his victims and their families. The judge who presided over the case condemned Geen for his betrayal of trust, stating that his actions had shaken the foundations of the healthcare system and eroded the faith of the public in medical professionals. The impact of Benjamin Geen's actions extended far beyond his trial and incarceration. His case prompted a reevaluation of security measures and protocols within healthcare settings.